Hello and welcome to this week's edition of the Weekly Roundup. I am your host, Gil Morgan. As always, we'll be walking through the latest in oncology news, breaking down the most impactful studies. Now, these are just some of our picks, and for a deeper look, we encourage you to subscribe to our weekly newsletter at www.OncoAlert360.com or through the QR and link in this post. That's www.OncoAlert360.com. Now let's dive in. In breast cancer, Roche has reported positive phase 3 results from the eVERA trial. The oral SERD giredestrant combined with everolimus significantly improved progression-free survival in ER-positive, HER2-negative advanced breast cancer, including in patients with ESR1 mutations, and showed a favorable trend in overall survival with no new safety concerns. This is the first positive head-to-head trial in oral SERD regimen versus standard of care. And these findings could meaningfully expand treatment options for patients progressing on CDK4/6 inhibitors. And moving on to our articles, in early-stage HR-positive, HER2-negative breast cancer, an analysis demonstrated that adding anthracyclines to taxane-based chemotherapy improved distant recurrence outcomes in patients with high 21 gene recurrence scores, showing how genomic risk can guide adjuvant therapy decisions. And on the supportive care side, the SAFE trial sub-study highlighted the short-term cardioprotective therapy with bisoprolol or ramipril significantly mitigates both left and right ventricular dysfunction in patients receiving potentially cardiotoxic chemotherapy, underscoring the importance of proactive cardioprotection. Turning to prostate cancer, the phase 2 PCS-9 trial confirmed that adding stereotactic body radiotherapy to ADT plus enzalutamide doubled radiographic progression-free survival in oligometastatic castration-resistant disease. This is without increasing severe toxicity. Another study in prostate cancer is the ARON3. This was a real-world study compared lutetium PSMA with cabazitaxel in metastatic castration-resistant prostate cancer. This found that lutetium PSMA offered higher PSA response rates, longer overall survival, and similar safety, supporting its use at least as an equally effective and potentially superior option. In GI oncology, pancreatic ductal adenocarcinoma remains challenging, but advances in neoadjuvant therapy, combination chemotherapy regimens like FOLFIRINOX, and targeted agents such as sotorasib and olaparib are helping to improve outcomes, while emerging immunotherapy and personalized approaches aim to overcome the tumor's immunosuppressive microenvironment. Meanwhile, in hepatocellular carcinoma, stereotactic body radiotherapy continues to demonstrate high local tumor control, a role as a bridge to transplant or downstaging therapy, and promising synergy with immunotherapy, although further studies are needed to optimize its integration with standard treatments. In lung cancer, this week also marks an important reflection on progress in thoracic oncology. 50 years of research have transformed non-small cell lung cancer care from a field where limited understanding to one where precise molecular profiling, effective low-dose CT screening, and expanding treatment options alongside improvements in supportive care and end-of-life care have happened. And just out, the COMPEL trial shows that continuing osimertinib combined with chemotherapy improved both PFS and OS in EGFR-mutated advanced non-small cell lung cancer. And the last article in lung cancer is a systematic review of first-line PD-L1 inhibitors reveals that adding platinum-based chemotherapy increases acquired resistance and shortened response duration, highlighting the need for individualized therapy strategies. And in ovarian cancer, a new Lasso regression-based model leveraging homologous recombination deficiency demonstrated strong predictive performance for PARP inhibitors outcomes, helping to identify patients most likely to benefit and outperforming existing HRD assessments, a step forward in tailoring treatments based on tumor genomics. And finally, in the field of radiation oncology, a phase 2 trial comparing proton craniospinal irradiation to photon-involved field radiotherapy in patients with leptomeningeal metastasis. This showed a significant improvement in CNS progression-free survival and overall survival with proton therapy, underscoring the potential of advanced radiotherapy techniques to meaningfully extend patient outcomes in this difficult-to-treat population. And that's it for this week's OncoAlert Weekly Roundup. I'm Gil Morgan. Thank you for tuning in, and I'll see you next week with the latest developments from the world of oncology.